Your leaking is affecting your quality of your life. That urinary incontinence, we don't want it. And I gotta tell you, there's a non-hormonal treatment for urinary incontinence. And guess what? It is exercise. And in this article from 2020, we know from randomized controlled trials that it suggests that exercise is positively affecting women, especially during the menopausal period. We know that exercise helps you with chronic disease. We know exercise is helping you with muscle bulk, and the more muscle you have, the more it helps with glucose regulation. It helps with blood flow to various places. Blood flow is never a bad thing to your brain and your pelvis. But pelvic floor muscle training, pelvic floor exercises, yoga-like postures, aerobic training, walking, exercise, weightlifting, these things are helpful for strengthening your pelvic floor. Yes, doing a Kegel or a pelvic floor squeeze by itself is helpful, but you don't have to only do that. You could actually also do mini trampoline. You could do, actually, they didn't talk about mini trampoline in this research, that's just me. Walking, weightlifting, exercise in general will help your pelvic floor get stronger. But the main finding of this study is that of the 3 studies that they liked the most, they found that the pelvic floor muscle therapy and quality of life was drastically improved. The urinary incontinence improved. The quality of life of the ladies improved. And I am here to tell you, exercise will help your pelvic floor strength and will help the quality of your life and will help your leaking. However, this is me as a women's health physical therapist. I'm going to tell you, sometimes when you start this exercise, you leak more. And so that thought stops you from exercise. Please don't let that happen. In another study from 2025, the effect of pelvic floor muscle training on urinary incontinence in postmenopausal women, let me tell you, the highlights are that interventions such as exercise improves leaking episodes. It means you leak less frequently. It means you leak less volume. As you get a better pelvic floor strength, you have a better quality of life. And yes, exercise is a non-hormonal treatment option of urinary incontinence, and it is a treatment option for the menopausal female. Now, it goes on to say that personalized options for treatment of stress urinary incontinence, such as seeing a women's health physical therapist, is the way to go. And I 100% agree. I actually believe that doctors of physical therapy are the best at prescribing exercise for you, because that's what we do. We make customized plans just for you. And the best exercise is the one you will actually do. So please, if you are leaking, if you have urinary incontinence, I need you to think about talking to someone about your pelvic floor and doing some strengthening. And just so you know, general exercise such as walking, weightlifting, and I'm going to say mini trampoline, believe it or not, helps strengthen your pelvic floor. Please don't be discouraged by the leaking. Do not let the leaking stop you from physical activity. And this is why talking about bladders in menopausal women is crucial for your health, because if you let your leaking stop your mobility, it changes your bone density, it changes your muscles, it changes your life. You will change if you let this leaking take a hold of you. Okay? Love you, bye.